Hi guys, welcome to Alpha Physio Pelvic Care, and today I will make a video in continuation from my previous video that is called Episiotomy, yay or nay. So in that video I was explaining the benefits or pros and cons of episiotomy, natural tear, how the two compare. Today we will actually talk on what to do or where to start when you had an episiotomy or a natural tear. So if you watch this video until the end, you will have a toolbox ready on how to help you to address the pain that you might have after the healing of the scar of episiotomy, the cut or a natural tear, and how you can help yourself in recovery. Believe me, this is information that is not given to women almost never. I see most of my clients who came here and I talk about addressing episiotomy or natural tear scar, about scar massage, about like basic stretches and so on, and none of them ever heard about it. Although the scar of episiotomy or a natural tear can cause a lot of discomfort, even pelvic floor dysfunction. It can intervene with your exercise routine. It can very often intervene with your intimate life when you restart. So it's very important to take care of that scar. Like any scar that might occur after surgery, whether bigger surgery or smaller surgery, it needs to be addressed. So a very, very quick recap on scars. I have here my wonderful model here. This is from the inner side. So usually episiotomy is done on the side, cut on the side. So here I have the actual vulva model. So this is your vulva, and the episiotomy is hopefully cut on the side. You can watch more in my previous video. And the natural tear usually goes straight down. In rare cases, you might have tear coming up, but most of the time it will go down. So if you're ready to continue to hear what we're going to do about this scar, don't forget to press like, don't forget to follow, to all the things pelvic health, yeah? And let's do it. So you had your scar. First thing you need to do is to let the scar heal. Good news is the area here around vulva is very vascular. That means it has a lot of blood supply. It has a lot of muscles around. It has a lot of veins, so it usually heals well. The not so good news, and it's kind of natural thing, but let's put it that way, is that this area will be stressed in a certain way and it's closed because we will be walking upright, okay? So the pelvic floor will still have to do the job of supporting our organs. So there will be some stress around the pelvic floor area, around the cut and stitches subsequently. So what we need to do in order to minimize the stress in a way that it doesn't interfere with our daily life. Let's start point by point. Number one, you really want to maximize your rest. And by maximizing your rest, I mean laying down. Like I'm sitting now here and I would be pressing now my stitches if I had any. So trying to lay down on the side whenever it's possible, even if it's 5 minutes rest. So resting it. Number two, keeping area clean and dry. So every time you go to the toilet, grab a bottle of water, and as you pee, let the water run over your vulva. That will dilute the pee and make it less concentrated, so it will make the scar and the burning sensation less irritable. After you're done peeing, you can just pat it with a specially designated towel, and that will be it. So keep area nice and dry and clean. You might use certain type of anti-inflammatory cream if you really feel that you need it, but usually it's not necessary. As well, you can discuss options of pain relief with your doctor. Number three, cool the area down. So I have here my nice cool pack that you put in the fridge, and then you can just put it in between your legs. You can sit on it a little bit. You can just lay down and put it between your legs. You can even put a menstrual pad in a freezer. Take it out of the freezer because many women will have the lochia, the post-pregnancy bleeding after giving birth. So those pads that you're using for that lochia, put them in a freezer. It will give a great relief. If you use the cool pads, just make sure there is something between the actual vulva area, yeah, and the pad. So it has to be either a wrap, or you just can stick it kind of in your trousers between the underwear, just to cool the area down. And you can repeat the whole thing up to 3 times a day for 10-15 minutes. It really will keep that swelling down. Right, so we talked about this. If you need to sit and you feel like there is a pressure going on, I would suggest that you use a simple soft cushion, or you can purchase a special cushion that has a small hole in between for the perineal area. What I would not advise you to do, that many moms kind of pass on to each other as a life hacks, is to use inflatable ring for the kids, you know, to swim, to sit on inflatable ring. Inflatable ring has a lot of tension. It's kind of stretching the area out. And as you sit, you don't just sink. So this is kind of your 2 butt cheeks. You don't just sink into it. You go also apart. So it puts stress on the area, and we really don't want any stress right now. Okay? And just taking generally good care of your health, good nutrition, drinking, you know, resting as much as possible. I know not always possible with the baby. If you go for walks, make sure you go for walks in the area where you actually can sit down, that you don't have 20-30 minute walk, especially as you just start having to walk that all distance without actually having a seat to sit down. So plan your walk where there is a bench where you can sit down and rest a little bit. It takes about 3 to 6 weeks to heal. If we're talking a grade 1 or 2, natural tears or episiotomy, usually 3 weeks. If we take grade 3 or 4, a deeper scar, it might take up to 6 weeks, providing there is no complications, no infections, no wound opening. To know more about the grades of tearing, refer to my previous videos about episiotomy, yay or nay, and I'll talk about, I'll show there about the tears and grading. So let's continue. After your scar has healed, the doctor has seen it, what to do about it. You can start to do your pelvic floor rehab, your exercises that are made for rehabilitation post-pregnancy. But what else you can do is to start a scar massage. And I will not dive very deep into specific techniques. I will show you just 2 simple techniques that are really effective and that are quite safe. I mean, it's very hard to go wrong with them, to be honest. So I probably use my hand here. Technique number 1. We want to massage that scar from the outside and from the inside, all right? So usually the scar is not only outside. The inside, there will be also some scar tissues, especially if you had grade 3+ tear or episiotomy. If you wish, before you start massage, you can take a mirror, lay down comfortably. Right, I'm sitting here in a chair. I'm not laying down comfortably, but you can either stand or lay down, your head propped up, and just have a look. Find your scar. It's not always possible to feel it, so it's good to have a look and know exactly where your scar is. Is it on the left? Is it on the right? Is it in the middle? How far does it stretch? So observing is always a good idea. And I can make later video detailed on observing and finding the scars. So thank you for your likes and the follows. And it will really, really inspire me to make more videos, including about observing the scars and assessing visually your vulva and your pelvic floor. Let's continue then. I will use my hand as an example, okay? So this is, let's say, your vulva opening, and you had your scar here, all right? It's actually a good area here because here is thicker, here is thicker, here is thinner. And this is exactly how it is with the pelvic floor. With your thumb, I will show you now in a minute in what position. With your thumb, you apply pressure to the scar, and you can start very gently in the beginning, okay? You don't need to poke it hard. Just apply, and you massage. And you go through the whole area here, okay? And you can do it for about 5 minutes every other day, as soon as you've been discharged and scar is healing. You don't need to do it daily or 3 times a day. We don't want to re-irritate area. We just want to desensitize it, to make it more mobile, more soft. Now, how to do it in real life is you take a chair, or maybe you are in the bath or something, and you need to provide access for the area, so you place one leg up, thumb inside the entry of the vagina, just outside of the vulva, okay? You can find it. You can use the thumb. When you massage from the outside, you can use your index finger or 2 fingers, okay? You massage from the outside. Or you can lay down and spread your legs open and massage this way. Now, when we go to inside of the scar, thumb in, about maximum you'll need 1 knuckle, max, okay? You don't need to go deep inside. Usually the scars are not so deep, and if they are, your pelvic floor physiotherapist, who hopefully you will visit after your birth for assessment, will tell you. But usually 1 knuckle is enough. So we go inside and we start to making swiping movements. We swipe, 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 swipe. Quite often after birth we have reduced lubrication, so feel free to use a lubricant. It can be a little bit of coconut oil, or if you prefer to use something more kind of medical, water-based lubricant, no additives, no flavors, no nothing, just medical lubricant, water-based, okay? So, and you do the swiping side to side, again for about 5 minutes. You can even do it in the shower whilst the hot water is running. You feel more relaxed, and you are in the position here, okay? Swipe. Nice and easy. Or you can lay down and reach as well, and can do these movements. I usually, myself and my patients, find it easier when they stand with 1 leg open, okay? They kind of have more control, more feeling of it. And literally 5 minutes. The whole massage procedure, 6-7 minutes. A little bit on the outside, a little bit on the inside. And you will feel when you need to apply more pressure. In the beginning it will be just gentle, just touching, just desensitizing. As you get to the sensation, you can stretch it a bit more. Nice deep breath whilst you're doing it, relaxed, and just listen to your body. As soon as you've been discharged, there is no way you're gonna reopen it or damage it, because you have to apply then a lot of pressure, and you won't be able to tolerate that pressure. So after you do all these procedures and you're ready for your pelvic floor rehab, that we will start talking about in the next videos. If you find, guys, this video useful, if you tried it, if you applied it, if you experienced episiotomy or tears, and what was your experience, where you advised things or nobody told you anything about, and your scar gave you tremendous troubles, please let me know in the comments. It's very important to me to have your feedback, and I will be very happy to answer to any questions you have. Don't forget to press that like and the follow button to have all your updates about things pelvic floor. Thank you very much for being with me today. Have all lovely days. Ciao, ciao.